everyone for being here today. I know we have a lot of interest in today's announcements, and I just want everyone across the state to know that we have approached this in a manner in which we believe that we are doing what is in the best interest of our state and what we believe to be in the best interest of school children throughout Mississippi. We know that we are facing two crises in this state as we tackle the question of how to reopen schools safely. The two questions that are before us: how do we prevent rampant community spread of COVID-19? And number two, how do we prevent the lifelong damage of extended school closures for our children? As Dr. Redfield said the other day, the question that is before us is public health versus public health. Both of these questions are extremely serious. Our office has been flooded with calls from teachers who are not ready to return to work. Those come right alongside calls from countless single moms sobbing into the telephone, about to lose their ability to provide for their child if they cannot get them back in school. None of this is simple. As I read through the 598 pages of school reopening plans this weekend, that's 10 pages of summary and 588 pages of reopening plans, I was struck by a few things. There are some who have presented the choice before us as chaos versus a blanket mandate. In my view, that is simply not the case. Overwhelmingly, schools are working hard to provide for a safe return. Every school had some contingencies for virtual learning, which we know will be at least part of the equation this year. Understand that our decision here today is the beginning of the conversation. It is not the end of the conversation. We know that 2020, 2021 is going to be the most challenging year we have faced. Every school had contingencies for virtual learning, which we know will be part of the equation. Let me say that again. We know that virtual learning will be part of the equation this year. All 144 districts have aggressive sanitation plans for classroom and common areas. All of them are working to socially distance their schools. For example, 132 of the 144 districts are providing meals only in classrooms to prevent kids from gathering together in the cafeteria. 71 districts provided detailed plans for a hybrid schedule where students would rotate between in-person learning and virtual education to provide for fewer children in the classroom. When you look at the guidelines that have been provided by both the CDC and the State Department of Health, it is critically important that the simple concepts that we have been referring to over the last 6 months in these briefings apply to our schools as well. We need to wear a mask. We need to properly socially distance. We need to make sure that we look out for ourselves and we look out for our neighbors. We also know, in looking at these plans, that there are 51 districts that plan to start sometime this week. There are 49 school districts that plan to start sometime next week. There are 14 school districts currently slated to start sometime the week of August 17th. There are approximately 23 school districts that are scheduled to start after that date. Obviously, there has been a lot of time, effort, and I believe thought put into each of these plans. Some of them, I would argue, are better plans than others, but they have all been thought about. They've all had local input. And I want you to know that there is a reason that we have elected school boards, superintendents, and an entire structure to make those local districts have decision-making power for their local schools. They are the most familiar with their staff, with their resources, and with their student populations. They have relationships with the teachers and the parents. There is no option before us without risk. But after reading their plans, I feel comfortable in this decision. Whenever possible, I will allow local school leaders to determine the best plan for their local schools. Those closest to the classroom will be best equipped to make those decisions. We have guidelines in place for schools from the Department of Health to guide their reopenings. They include staggered schedules where every household has the option for virtual learning. They include limits on class size, and even a delay of in-person class for teens and preteens as we start to see positive signs of moderation in community spread. All of those make sense to me, and I would urge every district leader to work them into your plans. Of course, each of those will have to be individually tailored as our schools are not uniform. But they represent the best possible wisdom that our health experts have to offer to mitigate the spread of COVID-19. One part of those guidelines offered by the State Department of Health is the requirement that all students and all staff wear masks while in school. We have seen over the last several weeks that when people participate and wear masks, it helps. We are seeing improvements in our numbers, albeit much slower than any of us would like for it to be, throughout our state. And I am convinced it is because we are seeing more participation by individuals in wearing masks. In fact, everyone I see in this room today, here in Hinds County, is wearing a mask. It makes a difference. I believe when we talk about masks in our schools, that is a universal floor that I feel strongly about setting. It will allow for a far safer environment for education. Today, I will sign an executive order that requires the use of masks by all adults and all children in our schools, unless there is a medical reason not to. We also need to remember the actual warnings of public health experts. The CDC says that the public health risk of extended school closures outweigh the public health risk of opening them. They are very concerned about the lack of nutrition, the lack of care, and the lack of supervision of kids across America. And I want everyone watching here today to know that I am very concerned about the lack of feeding, the lack of care, and the lack of supervision for our kids throughout Mississippi. Our kids face, in many instances without a stable home life, real challenges. In this entire 7 months that we've been dealing with this virus, we've talked a lot about essential versus non-essential activities. If there is anything essential in this world, it is our schools. We also know that teenagers can be effective spreaders of this virus, and we need to work to get our overall transmission rates down. To that end, based upon the data that is before us, I will also sign an executive order today to delay the start of the academic year for grades 7 through 12 in a handful of counties. There are a handful of counties that certainly reach that threshold of being hotspots. For this standard, we are mandating a delay in counties with more than an absolute number of 200 cases and 500 per 100,000 residents in the last 2 weeks. We must pump the brakes in hardest hit areas. The counties that meet those criteria are Bolivar, Coahoma, Forest, George, Hinds, Panola, Sunflower, and Washington. I'm going to reread those counties because this executive order, which delays the start date, is only for those counties. Bolivar, Coahoma, Forest, George, Hinds, Panola, Sunflower, and Washington counties. Every leading indicator that we have says that we are starting to see improvement in our state. Every leading indicator says that we are starting to turn a corner. Things are improving here. But that does not mean that we can declare victory and take a step back. In fact, it means exactly the opposite. It means we have to press our advantage. We have to take advantage of the fact that the curve may be turning over, and we must come together to beat this virus back. With that in mind, I also intend to sign an executive order today to require masks in public gatherings and retail environments statewide. I believe in my heart that we've got to get our kids back in school. I know that I want to see college football in the fall. The best way for that to occur is for us all to recognize that wearing a mask, as irritating as it can be, and I promise you I hate it more than anybody watching today, it is critical. If you wear a mask, if you socially distance, if we do the little things, it will make a difference. And therefore, I am implementing a statewide mask mandate today. Up to this point, we've kept the focus for masks on the counties with the highest spread. Now, with a 2-week push, I believe we can have the maximum effect and allow for our education for our kids to occur. I have taken a piecemeal approach. I've been criticized by it by an awful lot of people. But I've taken a piecemeal approach because I believe firmly that that was the best way to get the most number of people to participate. Admittedly, it took a few days, maybe even a week. But if you travel around in those 37 counties that currently have mask mandates, participation is far greater today than at any time during 2020. Our people, by and large, are rule followers. Our people almost exclusively have very big hearts. Nobody wants to get the virus and give it to their mom or grandmom and see them suffer in a hospital and perhaps even for the rest of their life. Everything that we have done has been about getting the most possible cooperation from the people of this great state. And I believe that there is enough motivation to safely get our kids in school that we can really juice participation of mask wearing throughout our state for the next 2 weeks. These are hard times. And hard times call for hard truth. We cannot and we will not prevent every person from contracting COVID-19, whether children are in school or whether children are out of school. And sadly, we cannot prevent all damage from this pandemic to our children's education and thus to our children's future. I've had an occasion to speak to leaders all across the country over the last several months, including Vice President Pence on Saturday. We know that great harm has already occurred across this country, and there will be more children who fall behind. I firmly believe that we must limit the risk in both directions. Throughout this pandemic, we've tried to operate with humility, understanding that we cannot be too proud to change course. We know that with this virus, times change every single day. The data changes, the situation changes, and we've got to be prepared to change as well. This is what I believe is the best plan for the initial reopening of our schools. Dr. Dobbs and our health experts have worked with us on this. We will continuously measure and assess the situation. Here's the bottom line. We have to balance the very real risk of the virus and the lifelong damage of school closures. To do that, we have to safely provide education for the greatest possible number of children. In my opinion, the best way to accomplish that is to provide guidelines, allow local school leaders to tailor them, and step in with the authority of state government if and when and where it is absolutely necessary. That is what we are doing today. This is the beginning of that effort. It is not the end. We will continue to provide resources throughout this state. We will continue to provide PPE and money and guidelines and guidance. And most importantly, we will continue to pray for everyone in this great state. Dr. Dobbs, please give us an update on the numbers today.
Thank you very much, Governor. Today we are reporting 1,074 new cases of coronavirus and sadly 42 additional deaths. If we look at our trends, we're hoping that we're seeing a bit of a plateauing of the number of cases, especially if you look at the date of onset. Make sure we look at that. That's a lot more telling about where we're going. But certainly we don't want to be too complacent because we do see these variabilities from time to time, so we need to monitor it closely over the next few days to see if this is a plateau. If we look at our hospital utilization, we continue to have significant stress in the hospital system. We have the most ICU patients that we've had to date at 314, 173 on mechanical ventilators, 963 in the hospital altogether. So some potential leveling on the total number of hospitalized patients, but still we're seeing a lot of stress within the healthcare system. We do maintain regular communications with them, and we understand they're under significant strain. So please stay safe and try to prevent the spread of coronavirus for everyone's sake. If we look at the school situation, we are monitoring closely the situation in Alcorn County and Corinth, where they have had several cases. Thus far, we've identified 6 students who have coronavirus. We're working closely with them to identify who those contacts are. We are working to test all of those contacts, and we're also working to understand what are the risks of transmission within that environment. The Corinth School District has done a fantastic job of planning, which has been very wonderful. I think it could be a real model for looking how do you do things safely and also understand how do you trace these students after an exposure. So this is a wonderful opportunity for us to work with them and learn for future exposures, because without a doubt, we're going to have every school that opens is going to have some child, some teenager with coronavirus walking through the door. Just based on the law of averages, we're going to see that. We've been working closely with colleges. Colleges have an entirely different scenario. We are not recommending at this time that they delay opening. We have other recommendations for them. Most of their risk is going to be outside of the classroom. It's going to be in the bars. It's going to be in the social events where we see them spreading coronavirus. So we're working very closely with them, and we'll try to do everything we can to minimize transmission on the college campuses. Would like to reiterate how important it is for people to avoid social events for the next few weeks especially, but really throughout a lot of this pandemic response. If we can all just chill out for about 2 or 3 weeks, consistent with the mask mandate, and just not go to a party, don't go to a shower, send your regrets to the wedding. I mean, a lot of these cases that we're seeing are linked to social events. We are undermining our ability to start school and to keep businesses open because we want to have dinner with our friends who are in from out of town. We're seeing this over and over and over again. So please, just for a few weeks especially, let's just relax and not do unnecessary social events and not spread coronavirus, especially our young kids. And if you're a teenager, let's just chill out for a couple weeks, almost a soft quarantine before school starts if we can, so that we know that our kids are least likely to go into the school with coronavirus. A couple of other things going on. We're very excited about the project in Lexington, Mississippi. We're partnering with CDC to try to offer testing to every single individual who lives in Lexington. And the goal of this effort, we'll see if we can encompass that community, offer testing to everyone, do immediate or rapid test turnaround, immediate case investigation, contact tracing, then testing those contacts, and then a test again in a couple of weeks, hopefully. Trying to see if we can do this sort of intensive intervention and really, from a hotspot perspective, stop transmission in its tracks. We're excited about this project. It actually was suggested to me by Dr. Redfield a couple of weeks ago. They were really excited about it too, so look for more information on that front. The last thing I want to mention is we did issue a public health order today that outlines mandatory isolation for people who have coronavirus. And the reason that we're doing this now is we are unable to contact every new case of coronavirus for a variety of reasons. Some of it is the growing use of rapid testing and the lack of reporting to us. We're finding more and more that we do not get all the reports of positive cases. Part of it is the delay in reporting by clinics and also laboratories, some of them. Most are doing a fantastic job, but a significant minority are not getting this information to us. And the third thing is the total number of cases is overwhelming our system such that we cannot do timely, individualized isolation orders. We're working with physicians and we're working on other mechanisms to make sure everyone understands what are those critical elements of isolation. And I would like to make a final or just an additional sort of plea, and we'll be working on this more, is if you're a medical clinic and you're doing rapid testing for coronavirus, you must report your cases to us. It is undermining the public health effort. I know it's another step you have to do, and I've heard people complain that they're too busy to do it, but it is legally mandated to report positive coronavirus cases no matter how you diagnose them. And that's all I have, Governor. Thank you.